All right. Well, excellent. Well, thanks everybody for joining. For those of you who don't know me, it looks like I know most of the folks on the line, but my name is Kyle Graham. I was recently voted in as president of Triboro Youth Hockey. I have two kids in the program, both are mites, and a third will join in 2 years. So we'll be with the program for quite a while. But in the first year with the board, kind of running as president, it's been interesting. And I've been really proud of all the work the board's put into our COVID planning, and in particular, just kind of being as nimble and agile as we can, as things are obviously really fluid at the moment. What we want to do tonight is walk you through, or at least answer questions on our COVID protocol. So Dr. Ryan Friedberg, he has a son in the program as well. He was gracious enough to volunteer to help us write these protocols. Ryan, I don't know if you want to take a second to introduce yourself, give a little bit of background. That's okay.
Yeah, thanks, Cal. I know some of the people on the line, don't know everyone. My son is a new peewee. He's been in the program since he was a mosquito. So my profession is I do emergency medicine and pediatric sports medicine. I trained at Children's Hospital for sports medicine, used to be a team physician for a bunch of the colleges in Boston before I started spending more time coaching my kids. I created many protocols and guidelines for St. Vincent's Hospital, where I'm an associate chief. So I've helped out with some guidelines for baseball in Westboro, a little bit with soccer so far. And, talking to Kyle, unfortunately, youth sports does not really have good oversight from government agencies with regard to guidelines. They go out to say what they feel are low-risk sports, what are high-risk sports, but they really don't give good guidance from a statewide level with regard to protocols. So I thought it would be a good idea if we created a protocol with Kyle and Theo's help and the help of the board, we came up with what we think is a pretty good protocol here that is based on CDC and mass guidelines. To help create these, I've spoken with many agencies, including our DPH, our Westboro Board of Health, and even I spoke with the president of Mass Hockey. So I did vet these through multiple people. I think this is a very good guideline. I'm hoping that the leagues create a good guideline with regard to exposures, not just with regard to prevention, so that we could create some sort of standard across the board. That's pretty much it, Kyle. I don't know if you want me to get into anything else. But.
No, I mean, I think what's important to note is, so this guideline is for Triboro. Each rink and each league is going to have their own set of rules, which we're still really waiting on. I know North Star, for instance, is going to have their set of rules come out tomorrow. So we'll likely send out an email over the weekend kind of outlining some of those rules. But, you should definitely be prepared for things like North Star, for instance, is going to require all players to show up fully dressed outside of helmets and skates 15 minutes before, to really limit any time in the locker room at all, or just force players to get dressed outside of the locker room. Because, as you'll see in the document, the big thing is we're going under the guides that hockey as a sport is not an exposure, meaning the actual act of playing hockey. We don't know that, right? I mean, no one knows that until we actually get into the season and start playing. But our hypothesis is that really where it would spread are places like the locker room, carpooling, eating together, if we play in tournaments, like the hotels. So really for us, it's about limiting those spaces in those places so that the kids can play as safely as possible. When the league and the rink rules do come out, we're going to be funneling them through to all the coaches. So the coaches will be working with the parents to kind of make sure everybody's aware of the rules that we kind of have to follow. I think it's just important to remember as a group that, we were very fortunate that the state of Massachusetts is allowing us to play. It's definitely a privilege. And, we following the rules that are set forth in these protocols will allow us to continue to play all season. We want to make sure we do the best that we can. We can't control the programs, but we're going to do the best that we can as an organization to keep everybody safe and healthy and playing hockey as much as possible. I hope everybody's had the chance to read the document. Really, we schedule this time. We can take, as little time as we need or the full hour, but was hoping to answer anybody's questions and really make sure that people on the call feel as safe as possible going into, practices as we start up in the games over the next couple of weeks. So with that, happy to open it up to questions and we can go from there. Are there any questions? Does anybody have a question?
Hey Kyle, only one parent per kid, huh?
For the time, yeah, it's gonna be challenging. So at the moment it's gonna be one parent. Full masks. We're gonna try to keep it limited and kind of see how that goes. Because like I said, each rink's gonna be different, and we want to make sure we're a little bit overly cautious. In particular, as you start getting Mite 1s and above, where you're in the valley and you're traveling to all different rinks. And then, as we see what the season's like, we'll see what we can reassess accordingly. But yeah, it's about trying to keep it as safe as possible. So I see one question in the chat about spectators be allowed for mites. So that is something we're waiting on the word from North Star about. The big thing is making sure that they kind of keep the flow of traffic going. So I know Steve Tepper and the team over at North Star have been trying to kind of figure out a way to have spectators. I would say, much to Doug's question, it's going to be very limited, if at all. But as soon as we have anything or hear anything, we'll be certain to let you guys know.
Kyle, I appreciate all of the leadership you've gone through over this past couple months, and Dr. Friedberg, appreciate all the work you put into this protocol. Can you clarify the use of the mask on the ice during games or practice? The kid's gonna have to wear this all the time, the mask?
Sure. So we're waiting for the league rules still, as I mentioned, but our inclination is that during gameplay, they will not have to wear a mask. We are currently under the impression that they may have to wear one on the bench. So we're trying to kind of understand what that would mean and how do they do that in a safe way. But we do know that the rinks will be keeping kids 6 feet apart. So like if you were to go into North Star now, you'll see all the different tape marks 6 feet apart. So, right now things are a little bit fluid, but while they're on the ice, like at practice, they will not be required to wear a face mask on the ice, like a mask under their cage or their bubble. What I can also say is that Bauer is coming out with a splash guard for their kind of bubble shield. It certainly is not mandated, but the hope is, and I've spoken to a couple folks at Mass Hockey, that would constitute or work as a mask. So it basically cover up in some way, shape, or form that the kind of opening at the bottom. Those are coming out September 12th, from what I understand. So that is also an option, but again, definitely not mandated. Definitely not, you don't have to buy those or wear one, but that's something else that's coming out as well.
Yeah, I was just curious. I mean, my daughter's soccer team, they wear the mask on the field, and some kids will use it and they'll take it off, or well, they'll just bring it down every now and then.
Sure.
But they are required to have it on during the game, on the sideline, and as best as possible. But
sure.
Yeah, hockey, I mean, God, you go out a minute and you're tired.
Yeah, I mean, they're different sports. I mean, I can't speak to soccer and the information associated with that, but I do know lots of different studies were done around hockey, and the actual exposure on ice, especially when you eliminate things like body contact, and the referees are going to be blowing whistles very quickly when the goalie covers the puck, things like that. It definitely limits it more than some other sports. But I can't speak to soccer, unfortunately. I don't have much information there. So another question in the chat, Ryan. I don't know if you want to take this one, but it says, what happens if there's a positive COVID case? So I don't know if you want to walk through that a little bit in more detail.
Yeah, so basically we're creating a COVID committee. So if there is a positive case, we would like whoever turn positive to let us know. What will happen is wherever they got tested, that test result will show up in a statewide database called Mavis, which will then notify the Board of Health for whatever town you live in. That Board of Health will then contact you, and they will do a contact tracing. We will do our own contact tracing. So if your child tests positive, they're going to be out for a minimum of 10 days. And then we will contact trace to see everybody else that they were around. So if we find out that your child carpooled with 3 other kids on their team, then those 3 other kids are out for 2 weeks. And we recommend that they also get tested. If your child was at a sleepover, and the contact tracing that we're going to do is only involves hockey. So if your child tests positive, we're going to ask what other hockey players from Triboro has he been around. We're not going to contact trace for the entire town. The Board of Health might, but we're not going to. And then that's basically the protocol. Your child will have to get cleared by their primary care doctor to return. Now, back to where we were talking about with the carpool, or if we find out that 7 people were in the locker room at the same time, even if they had masks on, then those are considered exposures. And even if they test negative, they still need to quarantine for 2 weeks because they were exposed to someone that was positive. So, the reason we understand that sometimes you have to carpool, and it's a great idea to wear a mask if you are carpooling. You just have to understand that if one of the kids in that van or wherever tests positive, then everybody else in that van is out 2 weeks, whether they're sick or not, whether they test positive or not. So that's why carpooling, or sleepovers with multiple hockey players, or even a pool party, can become an issue. And that, my only concern is if one person tests positive and they're carpooling with 4 other people, you may lose your team, just because of the way the teams are set up. So, for 2 weeks. So that's basically what happens if someone tests positive. I don't know if that is thorough enough, but I tried to keep it short.
Yeah. And for, I think what's important to know too is we're going to be leaning on the primary care physicians quite a bit. So, if someone has symptoms, and we basically ask you to go to the primary care, and then, if they recommend a COVID test, and that's when we kind of ask you just to notify us so we can be aware and make the appropriate decision. But as Ryan mentioned, we want to make sure that, we limit shutting down a whole team, or multiple teams as much as possible. There was an interesting article published almost a month ago now, but in the Globe, that talked about a state tournament for hockey, or a premier tournament for hockey, where there was a team from New York that got almost the whole team tested positive for COVID. What was interesting about that is not a single team that they played had a player that tested positive. So what that shows is, hypothetically, that the team that was actually playing on the ice they were against wasn't really exposed to COVID. It was more about the other stuff, like Dr. Ryan had mentioned, things like, the carpooling, the pool time, eating together afterwards at the hotel. And that's the area where we think there's the most risk for anybody. And again, if we find out differently as we get the season going, we're certainly going to be quick to make changes to keep everybody safe, and we'll make sure everybody's aware. I certainly hope everybody's noticed kind of the increase in communications from us with our monthly newsletters. Those will continue. And we will definitely be keeping everyone as aware as possible. That said, one thing you can be rest assured is that if you do email the COVID, it's going to be covid@triboro.org. But if you email that to reach the kind of COVID committee, you're definitely going to be kept confidential as much as possible, right? So we're not going to be blasting out anybody's name. Dr. Friedberg will kind of be leading point on that, and basically making sure that we only contact people you're in direct contact with, and we'll keep that as confidential as we possibly can.
And one other thing that we're going to do, just to let you know, is if, let's say you play a game on Saturday, and then on Sunday your child spikes a fever, and on Monday they get a test for COVID, and it's positive, we are going to recommend that everybody on the team gets tested. We are not going to recommend that they all are quarantined if the only contact was playing the game of hockey. So what Kyle said is we're not treating the game of hockey itself as an exposure, but we are going to suggest that everybody be tested so that we could find out, is hockey truly an exposure sport? Because in reality, we don't have enough of those cases like what happened with that New York team to prove it or not. We're suggesting that it's not, but we really don't know. If we find out that if one team has it and the entire team gets it, well, then we will have to change our guidelines. But as of right now, I'm not seeing any evidence that says that hockey is a high exposure sport with the act of playing. So that's going to be what our recommendations are going to be. Obviously we can't mandate or force anybody to get tested, but we are going to encourage it if a teammate tests positive.
So Ryan, another question in the chat is, how many days after exposure would you recommend a player be tested? I know false negatives are an issue early on.
So I recommend 5 to 7 days. And the reason 5 to 7 days is usually that's how long the incubation period is going to take, where you're less likely to get a false negative. And also, since you're already quarantining for 2 weeks, you should still be able to get that test back so that the test result doesn't last longer than the quarantine. So my recommendation is 5 to 7 days after the exposure. And unfortunately, if they get tested 5 days after and they test negative, and then 4 days later they spike a fever, they are going to have to get tested again, if they become symptomatic at any point in those 2 weeks. But, we had a case with the baseball where a parent tested negative 2 days after the exposure, and then 2 days later spiked a fever, and then tested again and tested positive. So, I don't really recommend getting tested too early for that reason. I don't think you need to.
Yeah, and it doesn't impact, Ryan, I know we talked before about the number of days you need to quarantine.
Yeah.
So I know it's a little wonky, so maybe you want to walk through that.
Yeah, so no matter what the test, well, let's say this. If the test is negative, you still have to quarantine for 2 weeks. If your child is exposed to someone and they test positive and they are asymptomatic, then they have to quarantine for at least 10 days after the test was taken, as long as they remain asymptomatic. If they develop symptoms, then it's a minimum of 10 days after the symptoms resolve. And then that requires a clearance by the pediatrician.
Great. So what other questions are there? I know a bunch of folks on mute, but any questions, feel free to ask them.
Are they going to have some certain types of limits about the number of kids on the bench or number of coaches on the bench at all, or?
Yeah, so we're definitely going to limit as much as possible. So it's 50. It's basically, from what I understand, it's 50 people can be in a group, and then and that basically is 25 per side of ice. So we're going to have to do our best to basically separate it by the neutral zone. In a game itself, players need to be 6 feet apart. We're going to limit the number of coaches in general on the bench just because it's safer that way. So the fewer the coaches involved, the better off in terms of COVID. That said, we're obviously going to try to keep people as safe as possible. So yeah, again, more to come out on exactly what the league and the rinks are going to require, but they are working with Mass Hockey and the DPH to make sure that we're safe as possible. And then for us to trickle down, like for instance, Friday Night Mites is probably not going to be the same this year, right? So having the 60 kids run around with 25 coaches. It's not feasible. So it's going to be a little bit different this year, but we'll do our best to make the best of it. And the good thing is the kids are on the ice, they're going to be able to have fun, and there's still a lot to gain from playing sports and playing hockey, even in a modified way. But we're excited and confident we'll be able to get them out there and keep them safe. In terms of the question around about the Bauer face mask coming out, so basically Bauer has a mask, a bubble shield called the Concept 3, and they're coming out with a splash guard which will fit across the kind of bottom half of it where the holes are, that we're hoping will constitute as an actual mask, as if they were wearing like either like a neck gaiter or something like that underneath. It's certainly not required, and it's not a mandate. You can still certainly wear the cage. Over the summer, my son's been doing a lot of camps at North Star. We've seen people with bubble shields. We've seen people with the mask under the cage, with just the cage. But that is a product coming out. From what I understand, it's coming out September 12th. And it will also fit the CCM shield, from what I understand as well. So again, this is just talking to the folks at Pure Hockey, so I'm not 100% sure, it's all accurate, but I do know that product is coming out, and that should be helpful. And then from a coaching perspective, again, we certainly can't mandate or force anybody, but we're going to ask coaches to wear masks as much as possible. Everybody will need to wear a mask in the rink when they're not on the ice. That's just that those are going to be rink rules, period. But on the ice, from a coach's perspective, like for myself, I'm certainly going to be wearing a mask. And if you can and you're able to, I would recommend it. But again, it's not a mandate or anything we're forcing or anything of that nature. What other questions are there? Anything else? We can, again, it's just to make you guys feel as comfortable as possible as you go in. So any question is a good question. So Dr. Ren has a question that says, what protocols are in place for a player who already contracted COVID? Will quarantine still be mandated?
So if the CDC and the DPH states that if you have contracted COVID within the last 3 months, then you do not need to get retested. I think the caveat to that is, can you spread it again? And the answer is we don't know. So if somebody had COVID and they've recovered from it, right now, as long as it was within 3 months, they theoretically do not need to quarantine again if they are exposed to somebody else. Now, I would still suggest that they get tested, and if they test positive, the question is, did they get it a second time, or are they still positive from the last time they had it? And the answer is we don't know. So what I would say is that no, they do not need to quarantine unless they become symptomatic at all, at which time, if they do become symptomatic, then I would say get tested to make sure they don't get it a second time. If the COVID test was over 3 months ago, then they need to start over.
Okay. And what I can say too is, like, when you read the guidelines, like in years past, like, a player might have had a sore throat or, a cough, and, parents wouldn't think anything of it, and they would kind of come to practice and kind of just go about their day. We are going to ask, like, if a player has a symptom like that, that you skip the practice, skip the game. I know it's unfortunate, but we want you to call the pediatrician, and we'll lean on them, right? So if you call and they say, listen, we don't think it's COVID for X, Y, and Z reason, and you get clearance from your pediatrician, then by all means, 24 hours after the symptoms subside, that is, they're welcome to come back. But we just definitely want to err on the side of caution because, especially with kids, like, symptoms can be minor, you can be asymptomatic. So any sign of kind of sickness, we're going to ask that you stay home, and hopefully that will mitigate other illnesses kind of floating around too, right? But we're going to try to be overly cautious if possible.
And we're instructing the coaches that if a child shows up coughing or very congested, we're going to ask them to go home. Like Kyle said, it's not just about COVID. You know, if all of a sudden you have 4 kids that got a standard URI that they otherwise would have played, well, now it's just going to take forever to get them all tested and back on the ice, even if they're COVID negative. So like Kyle said, you know, we want to try to prevent the spread of all the other viruses that kids usually get, so they don't have to go through the testing procedure just to get cleared back to play.
So the next question was around, I'm just going to read it. It says, are there any new issues that players or goalies might need to limit specifically, like goalies and transmittal during games to the goalies from the other teams? I'm not really sure about that question. I'm not really sure what you're asking, unfortunately. But if you want to either type it in or if you want to pop off a mute and chat, that's fine too. The next question after that is around multiple team practices. So will teams be separated on the ice or allowed to skate together during warm-up? So we're going to try to separate as much as possible. Again, you know, we're going to follow all guidelines. So keeping kind of cohorts separate. So likely, like, you know, things like, you know, in the past, you might line up on the goal line and do some full ice skating drills. Those are probably not going to be permitted. Again, that's just to, you know, basing everything off of the CDC and DPH guidelines. So it will likely be like half ice practices, multiple teams per sheet, but again, separated by 20 feet as best as possible. Next question is around coaches not wearing a mask on the ice. My understanding is that this is a mandate for mass hockey, and I certainly think we as a board should require coaches to wear them. Yeah, so I mean, basically, our ask is that you wear them unless you have some kind of health issue where you can't and you're skating full speed. If you're within 6 feet of someone, you definitely have to wear them. But there are definitely instances where you're 6 feet apart, and like for instance, you know, when I was coaching baseball this year, like if I was at home plate hitting ground balls, you know, I might have had my mask on so I could breathe a little bit better if there was no player within 6 feet of me. Something like that I think is okay. But if you're in there in the drill, you know, close within a foot or so of someone, you definitely need to be wearing a mask. And next week, Kevin Zena, who's our coaches coordinator, has a meeting. So for anybody in the call who's a coach, you'll have more information on that next week. We have a meeting, I believe it's Wednesday night, to kind of go through everything. And, you know, we'll update it as we see more. Are there more questions? All right. I guess you can get another minute and we can hop off if there's no other questions. Again, and, you know, if there's any questions, you know, if you want to email us, board@triboro.org is a great way to ask questions. You know, we're definitely here for you guys. So let me know, you know, what the, you know, if there's any questions at all. In terms of getting a copy of the protocol, we are actually going to require everybody acknowledge it on triboro.org. So we're going to be sending out links to a specific spot on our website that will have the protocol. It will also have the social media waiver as well as just the player guidelines for, you know, sportsmanship and things of that nature. And we're going to ask that everybody acknowledge, and we have a system, so you literally have to check a box on triboro.org to acknowledge it. So every player is going to be required to do that before they're able to hit the ice in a game. Or, you know, hopefully we can get out there before the 8th, which is the first game for the older kids. But yeah, the protocol will be there. And again, any questions at all, it's just covid@triboro.org. That email is set up. Dr. Friedberg's on that committee, myself, and then Theo Martineau as well. So any questions you guys have can go there.
Sure.
So were there any last minute questions before we call it an evening? All right. So with that, thank you guys so much for taking the time to join. I can't say how excited and happy I am to be able to get the kids back on the ice. Again, you know, the entire board is here if you guys have any questions or need anything. But other than that, have a great night, and we'll see you at the rink.
All right, thanks, Kyle. Take care.
Bye, guys. Take care.
Kyle, could you just hang on for 2 seconds?
Of course.
So you don't need to
Wait,
send
wait,
anything
wait,
to the,
wait, 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 wait one second.
yeah.